Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. I'm Harold Fisher. May is Mental Health Month, and tonight we take a look at the mental health of young people. Check this out. According to data from a national health interview survey released last June by the CDC, children 12 to 17 years old were more likely to have received mental health treatment in the past 12 months, 18%, compared to children 5 to 11 years old, some 11%. Now, that includes prescription medication or received counseling or therapy from a mental health professional. And boys were more likely than girls to have taken medication for mental health. Joining me to talk about this are Carolyn Hunter, early childhood educator and author of the children's mental health book, Sometimes Minds Get Boo-Boos Too, and Dr. Laura Okanlawan. She's a psychologist and facilitator. Ladies, thank you so much for joining this conversation.
Great to be here.
Thank you for having me.
Let me start with you, Dr. Laura.
Yeah.
When you hear about those numbers and that information that I just shared from the CDC National Mental Health Survey, what comes to mind? What's going on?
Well, we have to always take into consideration that COVID-19 was a big time, not just for us in our subset of communities, but we think globally. When we think about the impact that had, it made people really have to assess and come to terms with their mental health. Life changed for everyone. It was something that was a shared experience. And so I think that really opened the door for because mental health it's always been here. This is not the first May that we've celebrated Mental Health Awareness Month. But I think with the advent of COVID, it really propelled people to really seek services and get the help that they need. So
go ahead. I'm sorry.
So I think that's why we're seeing such drastic increases in the numbers of young people really seeking treatment.
Treatment for what?
Well, if you think about it, COVID, trauma, that's a big one. Trauma, anxiety, depression. We can get into the other ones as well, but if we can really hone in on those three, those are really big ones, again, that were really shared experiences across the board. It didn't matter what race you were, what SES you were. It didn't matter whether you were in a 2-parent or a 1-parent household. Lots of people were experiencing trauma. Lots of people were experiencing heightened anxiety. Lots of people were experiencing depression. Life changed for a lot of people. And as we've come out of it, and people are getting back to somewhat of a routine and getting back to quote unquote normal, people are prioritizing their mental health and recognizing that what I might have thought was just feeling sad is actually depression. What I thought was just a little bit of worry is actually anxiety that's making it really difficult for me to function in school, to have really meaningful relationships, to work and things like that.
But when we are talking about children, and obviously there is a lot of information out there.
Oh, yeah.
That was not available when, for example, when I was 12 to 17 years old. And as a result, what kind of impact do you believe the information and awareness has had, not only on the young people, but on their parents who are caring for them?
Yeah. Well, I think that, again, like I mentioned, Mental Health Awareness Month has been around for years. But what I think, again, is that we are, as a country, taking more responsibility of mental health. And I think prioritizing mental health. And with the prioritization of mental health, I think there is a decrease in stigma. Because if we think about it, in the African American community, there is such a big stigma worldwide actually, but if we're thinking about the African American community, there's such a stigma associated with when you're not doing okay mentally. It's not the same. It's not looked at the same when you're physically okay, not okay. People are able to wrap their minds around it. People are okay with auntie and uncle having diabetes, but then when you talk about schizophrenia and you talk about depression, it's more hush hush. But I think again, with the access, with the awareness, with this globally shared experience that so many people went through, the stigma has become less. And so parents are asking more questions, are having the language to ask appropriate questions. And in turn, I think children as well are also raising up their voices and prioritizing mental health. Social media is a big component as well, where, places like TikTok are safe havens for teenagers and young folks. And they see themselves in so many of these influencers and so many of these people who are sharing their struggles and giving them the terminology that they need. They now have the language to communicate how they're feeling.
Carolyn, you're doing a lot of head nodding. Your thoughts about what
Yes,
Dr. Laura has shared.
everything Dr. Laura is saying is so on point because as a caregiver, we're boots on the ground. We are right up close and personal with seeing these children and these families in our communities who are going through all of the stresses. And after the pandemic, children were kind of like pushed back into school and expected to just pick up where they left off. And there's so many anxieties. The whole mask anxiety was a real scary time for children. I have children in my care who didn't see their grandparents ever. They were born in the pandemic. And so they didn't even get to see family members. And children have lost loved ones. There's so much loss associated with the pandemic and PTSD from that and germ phobias and things like that. Even with the providers, I mean, opening our doors again, not knowing what's going to happen. We've lost providers in our community to COVID. And so it's a new normal. It's a new normal. And we all have to embrace mental health awareness and kind of pull together and work together. And I know in the state of Maryland where I live, the early childhood education has just given us just a wealth of information on social emotional learning and how to communicate better with our children and our parents. Because if you don't have a healthy parent, you're not going to have a healthy baby. Even I would say, even as far as a healthy mother with a child in utero, if she's not in a good headspace, that has a direct impact on that baby and when that baby comes into care. So I definitely, champion anybody who is going to get on board and help bring awareness. And I really think that to tear down the stigmas, we have to normalize mental health. I'd say in my book that it's just the same. If you had a sneeze and you needed a tissue, if you had a tummy ache, you would ask for help for that. So if you have a mental boo-boo, it's okay. You can ask for help for that. It's okay. It's the same. It's no different. You don't have to feel ashamed about it.
I do want to talk about that book in just a bit too. But Dr. Laura, you looked as if you were about to make a comment.
I think, what you said, Carolyn, I think is so spot on. And you think about, just even the children born in this new normal, obviously, we were referencing, children who are a little bit older, but even with children who are, that 3 to 9 year old, I think that it's really important that they also have the terminology and the language. And obviously it's not going to be to the same degree as a child who's in middle school or high school, but, understanding that mental health and mental health awareness starts from an early age. And when parents have the words to say, when parents, advocate for children to identify how they feel, identify the emotions that they're feeling, then we're able to understand a little bit more. Because if we think about it, young school age children typically will discuss somatic concerns. So they might not be feeling well, they might be feeling sad, but then they'll equate it to a tummy ache, or they'll equate it to my head hurting. And so making sure that parents understand that it's important to give your children the language, and that could be
Yeah.
visually, and then also advocating by modeling. Is it really a tummy ache, or are you sad? What are you sad about? Some of those things are just ways that we can tear down the stigma and also educate in the same token.
Yeah.
You mentioned earlier, Carolyn, about social emotional learning. And I was struck by that because just last week, DC Public Schools made an announcement that starting this fall, they were going to begin a implementing social emotional learning for grades K through adult
Awesome.
education.
Awesome.
For those who are not familiar with that, what is social emotional learning?
Social emotional learning is the ability to experience and regulate and express emotions. And it is teaching a child about self-awareness when they become aware of their feelings. It's giving them, like you said, Doctor, the verbiage, the vocabulary to associate with their feelings. And in doing that, the main tool for that for me is kindness. I am a kindness fanatic. I teach kindness in everything. It's the crux of everything I write, in every lesson I teach the children. Because once you have that awareness and you have that ability to treat yourself with kindness, then you can become that empathetic, caring, compassionate person to other people. And it just expounds across the whole board of learning and socialization and building healthy relationships with the other adults and other children. And it's just a way to help children thrive. They can't thrive otherwise. It's so important. I'm elated to hear that they are implementing social emotional learning. And it's so important, and that's why I have such a passion about it and write about it in the books, because I always say children need a soft landing for hard topics. There's so much. There's the pandemic. There's bullying, cyberbullying. There's um, just drugs and low self-esteem, poor self-image. There's so many things, gun violence,
Yeah.
domestic violence in the home, racial disparities, and social economic disparities. Some children just go to school hungry. They don't have enough to eat, and they're expected to go and learn. And they have so much pressure on them that they didn't have um, prior to the pandemic. It was existing, but it wasn't at this level. And again, culturally, I know in the Black community, we've always been taught, you don't tell your business. Don't you go to school talking about what goes on in this house stays in this house.
Yeah.
So there's so many hands over our babies' mouths where they don't feel like they have a voice. But social emotional learning makes them aware that they do have a voice and they have a choice. And it gives them the tools to cope, and it gives them the tools to manage, and it gives them the tools to exercise using their voice.
I'm going to take a really deep dive into the social emotional learning piece after this break. And I also want Dr. Laura to share her thoughts about it. I also want to talk about the book. I need to talk about the parents' role
Yeah.
in the mental health of their children. We've got a lot to discuss
Yeah.
during the next 30 minutes. So please stay with us. I want to take a quick break, but I want to remind you, you can hear this and every edition of the Daily Drum Insight segment via podcast on WHUR.com. Please stay with us. The Daily Drum will continue on Sirius XM channel 141. Of course, the original Quiet Storm with John Mons is next. That's on WHUR-FM. I'm Harold Fisher. This conversation continues on Sirius XM channel 141 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We continue our conversation during Mental Health Month as we discuss youth and mental health. My guests are Carolyn Hunter, early childhood educator and author of the children's mental health book, Sometimes Minds Get Boo-Boos Too, and Dr. Laura Okanlawan, psychologist and facilitator. I want to go back to part of the discussion that we were having right before the break, and I think this is so important, Dr. Laura.
Mm-hmm.
Carolyn mentioned she mentioned so much about social emotional learning, but
Mm-hmm.
I'm about to, as I often do, open up a family-sized can of worms
Oh yeah.
because I remember this is pre-pandemic
Mm-hmm.
when a lot of educators used to be criticized, and not just educators, but educational systems,
Mm-hmm.
school districts. There was a lot of criticizing about Black children, particularly Black boys,
Yes.
who were not receiving what was called at the time culturally competent instruction.
Oh yeah.
Teachers, the criticism was that teachers, particularly those teachers who were not Black teachers,
Mm-hmm.
did not understand cultural cues, behavior.
Mm-hmm.
Children, particularly Black boys, where
Mm-hmm.
they were acting out
Yeah.
or labeled acting out. Thank you for the air quotes.
Mm-hmm.
Where they were labeled acting out when they just were not familiar with some of the cultural cues and what have you.
Yeah.
So fast forward to 2024. Is culturally competent education still part of that issue, or do we say now that part of those issues were youth mental health concerns? Is there a bit of both? What do you say?
So I think we have to take this in parts, right? So I think that it's always going to be a concern. I think just as I'm a psychologist, it doesn't matter that I'm a Black psychologist. My Black experience is very different from yours and very different from Carolyn's, right? And so as I am trained, I'm trained to be aware, but that doesn't mean biases don't still creep in. And it's still the same for the educators as well. Just even personally, I have a Black son. I have a Black son who's in elementary school. And I've made it a point since he's been in pre-K 3 to talk to every single teacher he has had before school has started, because I know that my son is very energetic. I don't use the word hyper because I think hyper has a negative connotation for the reasons you just kind of mentioned, and so I would talk to every single teacher and say, I want to let you know that my son is very energetic, but he is amazingly smart. He's well-spoken. And if you tailor your learning style to him, he will thrive in your classroom. And that has been the theme since he's currently in kindergarten. So it's not like he's been in school forever. But my point, the point I'm trying to make is that I've had to do that because I'm a psychologist, because I'm a Black psychologist, I understand the implications of being labeled, because that is what happens. Typically, African-American boys are labeled with diagnoses like ADHD. They are misdiagnosed with labels like ODD. So that's oppositional defiant disorder. And they're labeled with more externalizing disorders as opposed to internalizing disorders. So the outward expression is what they're labeled as opposed to, like I talked about, those feelings. Like I might say my stomach hurts, but that's really manifesting as depression.
Mm-hmm.
And you'll see Black boys, their counterparts, are labeled more with diagnoses like depression and anxiety, whereas Black boys are labeled more with ADHD and acting out and misbehaving, and so I feel that because this has been so prevalent, and I think that there are a lot more allies. So not necessarily people in the mental health space, but people who really are taking mental health and trying to push this agenda forward. There has been more awareness to this. And so I think that educators are this is becoming a part of the training that educators are having to take and to be mindful of. And I think, again, because parents now have the terminology, more parents have the terminology, I think more parents are advocating for their children as well. Because when you don't have the words to say, be it a child or an adult, you're at a disadvantage. You're at a disadvantage, and you aren't able to advocate as wholly as you might if you had the words to say. So I do believe that there is more awareness, and I do believe that the narrative is shifting, but I still think that the numbers are skewed, not in favor of African American children.
Mm-hmm. Carolyn, you mentioned that you teach kindness, and I think it's remarkable that some children you don't have to teach kindness to, because why? Because they are exposed to it by osmosis, parental osmosis, or what have you. But when you find that a child has not been exposed to some of those social, emotional learning tools,
Mhm.
and at home they experience the opposite of, say, kindness, how does that work when the Carolyns of the world are trying to teach kindness, for example, and yet they go home to the opposite of that?
I think the children are a product of their environment, true.
Mhm.
And if their environment lacks empathy, you can't expect a child to be empathetic towards another child or anyone. If the home lacks um, the ability to talk, to open up, to embrace one another, then that child is going to come into my classroom and be kind of closed off to that, not open to sharing. But the majority of their waking hours are spent in schools and child care facilities. So we have a great opportunity to just implement kindness and demonstrate it. And it's not so much a lesson that you learn on a board, it's the experience, it's the hug, it's the listening. Children want to be heard. They want to know that they're important. They want to, and when you offer that to a child, eventually they will receive it and they'll learn the importance of sharing that with other people, that everybody needs it. Everybody, in order to thrive, we do need to have kindness and for ourselves and for others. So um, a lot of times parents are broken when they come. It's not just the child. We serve the family. We are family caregivers. And um, parents are going through a lot right now, especially the young parents. They're really struggling. They're struggling with their relationships with their parents. Um, they're struggling with their ability to provide for their families in their own interpersonal relationships, and all of that impacts the child. The child is witnessing all of this, and they come into our environment with a whole lot of pain, a whole lot of baggage, a whole lot of stress. And we're kind of like the soft landing that I spoke about earlier. And I just think that kindness is a vehicle to get us there, to get us to the other side of the pain, the other side of the stress, through being kind to the children. They learn by example.
Hmm. I want to talk about sometimes minds get boo-boos too. What was the genesis of this book? Where did this idea come from?
Well, I've always had a love for writing children's books, and as a child care provider, we would take different courses, and we took this child literacy course, and we had to write a book, and the instructor said, you should really publish your books, and I never did. But the pandemic the pandemic brought a lot of bad things into our lives, but the pandemic kind of pushed us into some things that we should have been doing all along. And I'm one of those people. So quarantined, I sat down. I mean, what could we do? But and I just watched all of the chaos. And I thought to myself, children are watching all of this. And they're probably more confused than ever now because the adults are yelling over masks and all kinds of things. And it's scary and it's just a confusing time. So I got my information. I took some classes at Johns Hopkins online to become a tracer for COVID. And that's how it all started. So I just wanted to give children um, an explanation for some things that were going on. And as we went through the COVID, I wrote the COVID book, and then I wrote the vaccine book about the vaccine because that was a completely just
Hmm.
insane time. So I explained that in childlike terms about the vaccine and made a little rap song to go with the book and everything. And then as we got out of the pandemic back into schools, there was this explosion of depression and anxiety and loneliness and isolation with the children. And it just warranted some more explanations in the books. And they had
So,
all of these feelings. And we're famous as providers for saying, use your words, use your
yeah.
words. But if they
Mhm.
don't have the words,
Oh yeah.
how are they going to use them?
Yep.
So that's what this book does. It gives them the words
So
so that
what's
they can use them.
what's a mind boo boo for an age appropriate conversation that you would have for a child who was reading this book?
Well, the way I wrote the book is in rhymes, which is a fun way to learn
That's
how to
good.
read. It's for early readers ages 4 through 9. And um, it's a way that they can memorize. Even children who can't read yet, they'll finish. I've had children that can recite almost this whole book to me because it's in rhymes. And it's almost like learning a song. And
Okay.
so what I did was I merged real life backgrounds with the animated drawings because sometimes things that we think about are real and sometimes they're not. So I wanted to give a little bit of a visual for that. And I came up with the narrator of the book, who is my dog, Maxie, who is the most odd looking. She's hairless. She has big blue eyes and she's real skinny and scrawny, and she's just odd. And so she's narrating the story, and she's Hannah's best friend, and she's telling all about the feelings that Hannah has.
Hmm.
So the way I designed the book was Hannah's mind is here on the outside of her face, and she has the same expression on the mind as so that they will associate this is Hannah's mind because it looks like Hannah. It has Hannah's
Exactly. Okay.
eyes, Hannah's face. So I start off explaining that what the mind does. The mind is where our thoughts live and grow. It's the treasure chest that holds all we know, like dreams and memories of places, people, and things, and the beautiful bird song that the nightingale sings. So it shows a picture of the mind as an artist,
Hmm.
and it says our minds help paint the picture of how things make us feel and hold our many countless thoughts, some pretend and sometimes real. So it
Let's.
just lets them know this is where all of our feelings are stored in our mind. And then it goes on to talk about this. What are those feelings? Sometimes we
Let's see.
feel sad. Sometimes we're angry. Sometimes we're happy. We have so many different emotions that are in our mind. And the same way we would have a part of our physical body that doesn't feel good, we can have a part of our mind that doesn't feel good too.
Yeah,
And it
that
says,
that is I think a really great way to illustrate to the very young. Obviously, um, the those pictures that you just shared with us, and for our radio listeners, if you're interested in seeing what Carolyn Hunter is talking about, you will be able to actually see this conversation on WHUR.com after 8 o'clock tonight. This YouTube video will be posted on our WHUR.com website. To the point that you just spoke about, Dr. Laura, we were talking about, or agreed to, I should say, use your words.
Mm-hmm.
When traditionally men, all men,
Yeah.
but Black men obviously, have always been, how can I put this, less likely to use their words.
Yeah.
And particularly when you're talking about raising young Black boys.
Correct.
We have heard over the generations, don't cry, suck it up.
Pick it up, be a
And
man.
so, and we've also heard this term now about raising boys into men who have toxic masculinity. And that's an entire show in and of
Completely
itself.
different.
But with that said, how can a progressive thinking father,
Mm-hmm.
okay, a self-actualized Black father,
Mm-hmm.
a thoughtful Black father who wants to raise a young Black boy to understand masculinity,
Mm-hmm.
but also be emotionally healthy,
Mm-hmm.
mentally healthy.
Mm-hmm.
Is that a bridge too far to ask sometimes for some of us, Black men
Mm-hmm.
who may be struggling in that same area?
Yeah. So, your questions are twofold always. you know, you know,
You get hurt, don't I?
it's twofold. It's not just step one. I think the part you're wanting, obviously, the answer to is like, what can the father do to the son? But I think it's really important to even go further back than that, right? I think that, Carolyn, you touched on a couple things that I think are like so important. But when you're thinking about the home life that you've grown up in, and Harold, you said self-actualize, right? Before you even get to that, right? You get bare bones and you think about what do I require to feel to grow up healthy, self-actualized? You need to be in an environment that's stable, supportive, where you feel safe, right? And so when you include things like instability, aka neglect, aka abandonment, aka things like divorce. So we're not even talking about like the gun violence that Carolyn talked about earlier, those big, what I call big T traumas. I'm talking about just the things that happen in your core family. When we have issues like that, that's where it starts, right? That social emotional piece that we were talking about, that social learning starts there. So if a father is coming into a situation where he is dealing with his own instability, where he's dealing with his own inabilities to communicate his emotions because he was taught not to do it. If he was in an environment where he was not, where he was neglected, where he did not feel loved, where he did not feel protected, it could be one side of one coin. It could be that this father now runs in the direction of wanting to provide that for his child, or it's a pattern that's built on itself. So that's where it needs to start, is this awareness. I think we talked about that self-awareness piece earlier, about like, what am I lacking? What am I lacking and what do I need? If I am telling my son or my child to communicate, use their words, do I have the words to even give them? right? I think a common phrase that parents unknowingly say is calm down, right? Calm down, but how is that helping me calm down? How are those words helping me to calm down? So I think one piece of this is now emotional identification, be it for the parent as well as for the child, right? And great ways to do that are through books like Carolyn's, but then also I think very like sheets that can be printed off the internet for free, where you can get a feelings chart, right? In therapy, patients will always say, I'll say, how are you feeling? I'm okay. Okay is not a feeling. Good is not a feeling. Fine is not a feeling. If we want to get down to it, how are you feeling? Are you happy? Are you content? Are you angry? Are you frustrated? And then from there, that's pulling out conversation. So as a father, if I'm hearing that you are sad, that prompts me to now say, well, why are you sad? What's making you sad? And from there, again, we're peeling back layers. We're able to kind of get a little bit deeper. But when we're kind of doing the surface level thing of like, don't cry or calm down, and we're not, again, equipping our kids to have the words to say, there's always going to be a disconnect. So fathers can equip themselves with the terminology, be themselves comfortable with the terminology themselves. Okay, how am I feeling? What's going on in my body? When I'm angry, how is that manifested? How are my children seeing the manifestation of my anger? How are my children seeing the manifestation of my sadness? Right? We just going back to what we talked about, like African American boys, typically they show frustration and sadness through outward expressions, right? So I could be sad, but what you're seeing is irritability. It's the same with adults, yes. So most commonly, you will see irritability is a criteria for depression in children, and we see most of that in African American children. And so if I know that, if I have that knowledge, I can now say, okay, this is irritability. What's causing the irritability? Could this be more than just I'm frustrated about something, or could this be a deeper thing? As like, could this be depression or sadness? So I think it's that education piece that I think is so important. But then also now, like, can we equip our Black fathers, our Black mothers, parents in general with ways to now support, and I think that's that second piece is that.
Carolyn, I'm sure you remember years ago, 10, 15 years ago, when public health experts came out and they started talking about gun violence being a public health crisis.
Yes.
And if we can drill down a little bit, the effect of gun violence, of other kinds of issues that you mentioned earlier, poverty, inadequate education in our urban areas, and the mental health response to the public health crisis, the mental, what happens mentally to our children who are raised in environments that are underserved and air quote noisy, unsafe environments. And I'm not talking about sound. I'm talking about, noisy as a description of lack of peace.
Exposure,
exactly.
Yeah.
What impact does that have on children? And as parents who are aware in these communities, what can they do?
Well, that's a loaded question.
Loaded question.
I mean, short of winning the lottery and moving to the country.
Yeah.
If you are in this community, you can't move. How do you create those soft places for children to land when they are constantly exposed to gun violence, lack of services, and the like?
Well, I think number one, they need to be exposed to not just well, nobody wants to be exposed to the bad part, but they don't, you want to open doors where they can visualize themselves in other environments. If you can't see it, you can't be it. You have to be able to see yourself in another light. You don't, this may be where we are today, but we don't have to be here tomorrow. And as far as children and parents have to, I think, do an assessment and not give the child a directive to we have to address your mental issues when they haven't addressed their own. Um, I would say make it a journey. This is something new. My parents, and I say be open if your child is mature enough um, to have that kind of conversation. I just think the honesty um, of telling them I didn't have somebody to talk to, and I learned a new way. I learned a better way. And this is something we can do together. This is a journey, a mental health journey that we can take together. And it's giving that bond, is strengthening the bond between the parent and the child, and giving that trust that they can come and share. That the parent is not somebody that has it all together or is looking down on a child, that you're less than. This is something that we can work through together. This is a journey we can take and learn and grow from. We're never too old to to grow and learn. So I would say that, and in the environments, just to create an inclusive environment where even if a child does not have that at home, they have it when they're in school. They have it when they're in their caregivers environment, so that they can see a different way. If all they see is one thing, that's all they'll ever know. That's it.
Hmm. Dr. Laura, I've got a couple of minutes. I'll let you share some final thoughts about young people, mental health, where we are, and is there light at the end of the tunnel?
Um, I absolutely think there's light at the end of the tunnel. Now more than ever, people are accessing resources. Now more than ever, with the advent of tools like BetterHelp, where I think talking about pre-COVID and post-COVID, people thought you had to go to therapy. I had to drive to the therapist's office, spend 45 minutes to an hour there, drive back. It had to be midday. People are able to go out to their car on their lunch breaks and have therapy now.
Hmm.
They are providing school psychologists and pretty much outpatient programming in schools. They are like access. BetterHelp is like a tool, like I said, where you can text your therapist before you start actual video sessions. You can text, you can talk on the phone. So the access to resources is out there, and I think that that's the benefit right now. And I think, again, because of platforms like social media, where it's constantly being talked about, celebrities are constantly trying to advocate for their mental health. We see people in prominent positions like the Mrs. USA, who,
Yeah.
announced just recently to prioritize her mental health. Naomi, the tennis player, who also took some time off from playing because she wanted to prioritize her mental health. So
Yes.
I couldn't remember her last name, but yes,
Right.
people are advocating and actually speaking up about prioritizing their mental health. So I think the stigma, while it's still there, it is slowly being broken down. And I think, again, the micro level is where we come in. These type of conversations, these type of books, seeing it and hearing it from people who look like us, who have shared and lived experiences. That is where we continue to kind of break down these walls. But I think, again, it still goes back to continually having the conversation, and those conversations start in the home. So if I am modeling that in the home, if I am providing a safe atmosphere for my children to tell me how they feel, if I am also expressing myself in a healthy way, that is what's going to help educators be able to take the next step. Because the thing, unfortunately, what happens is, like Carolyn said, they're spending so much of their time at school, but just as quick, that stuff can be undone at home. And so
Yes.
again, it's the wraparound services, it's the sports, the coaches, it's the educators, it's the family, it's the churches, it's everybody's responsibility to really wrap their arms around children and then be okay with sometimes not being okay.
Mhm. I think I'll have to let that be the last word, but uh, parents and teachers and everyone, we have to pay attention to what is going on with our children, or certainly there will be difficult consequences. Ladies, thank you so very, very much for having this important conversation with me.
Yes,
I
thank you.
appreciate your time.
Thank you.
Thank you so much.
That is the Daily Drum for this Tuesday, May 21st. I'm Harold Fisher.